Okay, afternoon everyone. I shall start, yeah. Can see the screen. Wait, okay. Okay. Okay, afternoon everybody. You all can see my screen, right? Can?
Yes, can.
Okay, can.
Just
That's good.
started, is it? Hello, good afternoon. Just started lah.
Yeah, I just started only.
Came here a bit late. Okay, thanks.
You're on time.
Okay.
Okay. Hi, afternoon everybody. Hope everyone has taken your lunch. Okay, so I'm Summer City, and with me today is my colleague Dr. Rosalie. So we will be giving a talk on urinary incontinence. Okay. So what is our content for today? We will be going through what is urinary incontinence, what causes urinary incontinence, the risk factors of urinary incontinence, the types of urinary incontinence, and how do we manage and treat urinary incontinence, and lastly, management of healthy bladder. So anybody know what is urinary incontinence or not? Just maybe shout out the answer. Anybody knows? Nobody?
In Mandarin, 像尿失禁 something like that.
Correct. Okay, it's correct. Okay. So urinary incontinence is basically when you cannot control your urine. There's like urine leakage. And then a lot of men and women actually suffers from urinary incontinence lah. But of course, I want to say lah, because a lot of people do not want to talk about it as they might be embarrassed, or they might even think that nothing else can be done lah. So urinary incontinence is not only a medical problem, it also can affect emotional, psychological, and even your social life. Okay, so a lot of people who have this problem, they are actually afraid to do normal daily activities, like maybe going out, or do not want to be too far from the toilet lah. Okay, and a lot of people also think that urinary incontinence is just parts and parcel of getting older, which is not true lah. It can actually be managed and treated. Okay. So what are the symptoms of urinary incontinence? So the symptoms includes occasional minor leaks of urine from small to moderate amounts of urine, which is very frequent. Okay. So what are causes of urinary incontinence? Okay, so we have two causes of urinary incontinence, which includes temporary, which can be cured, and permanent. So the temporary urinary incontinence, what is it? Okay. So certain drinks, foods and medications may act as diuretics. So what is diuretic? These are food substances that actually irritate the bladder, causing to produce more urine, and then stimulate your bladder to actually leak the urine out. So what is it? It includes alcohol, caffeine, carbonated drinks, and even sparkling water. Okay. Chocolate or foods that are high in spices, sugar or acid, especially citrus fruits, and heart and blood pressure medicines, sedatives, and muscle relaxants. Okay. Urinary incontinence may also be caused by urinary tract infection because it can irritate your bladder, causing you to have strong urges to pass urine, or even constipation. So why constipation? Because when the stool the feces is in your rectum, it presses against the bladder, which causes the urine to leak out. So another type is a permanent urinary incontinence. So this permanent urinary incontinence can be caused by everyday activities, underlying medical conditions, or even physical problems, which we will go through later on. So in females, mostly the causes includes menopause, because in menopause, a woman produces less estrogen, which is one of the female hormone. And then this hormone helps to keep the lining of the bladder and urethra healthy. So what's urethra? Urethra is where the urine flows out. Yeah, it's the urine tract. Okay. And secondly is childbirth. Childbirth, so in childbirth, the pelvic floor muscles became weakened. Okay, and this becomes more marked due to, and then vaginal delivery can also weaken the bladder muscles and the surrounding tissue, which leads to a prolapse or a drop pelvic floor. So with this drop pelvic floor, the bladder, the uterus, the rectum, all can be pushed down from the usual position, pressing against the bladder and stimulating frequent urine output. Okay. For men, so we said many women and men can have this urinary incontinence, right? So for men itself, urinary problems may be due to the prostate problems. So prostate is a small organ that surrounds the male urethra, okay, which is the part where the urine flows out. And it tends over time to get enlarged in the later life. So the urine, because it gets enlarged, it presses against the urethra, which blocks the urine flow from flowing out. That's why we have a lot of our male residents actually says that I pass already, but I keep passing out because I don't feel the bladder empty fully. So it could be due to a prostate problem. Okay, and the next one is bladder damage. Surgery can be done in severe cases, but sometimes the incontinence come after the surgery itself, which causes the bladder damage because the prostate is very, very near to the bladder. Okay. So for men and women, the common one, which is spinal cord injury, stroke, Parkinson's and dementia, or diabetes. So nerve damage can interfere with nerve signals involved in bladder control from diabetes or stroke and all these underlying conditions. At the same time, for Parkinson's and dementia patients, we might have difficulty moving from the toilet, from the place itself to the toilet due to physical immobility. So that's why the time to go to the toilet will take a longer time, and then cannot control your urine. That's why the urine will flow out. Okay. So again, the risk factors, gender, as you can see from the slide itself, male and female can have urinary incontinence. It's not only one gender have this, both can have urinary incontinence. Of course, women are most likely to have urinary incontinence due to pregnancy, childbirth, and menopause. And then men can have prostate gland issues. Okay, and age, as you get older, for everyone, the muscles in your bladder and urethra loses some of its strength. So definitely your bladder have lesser control to hold your urine, and the urine might flow out. Next one, overweight. As this extra weight increases pressure on your bladder and surrounding muscles, which weakens them and allows the urine to leak down. Okay. Next one, smoking, as tobacco may increase your risk of urinary incontinence due to some of the ingredients that might trigger the bladder. Okay. And lastly, family history. So if a close family member has urinary incontinence, especially urge incontinence, your risk of developing the condition is higher. Okay, just a...
Go back to the previous slide. I want the screenshot.
Okay.
Okay, thanks. Okay, thanks.
Okay. So K9, do you know how many types of urinary incontinence? Okay, just roughly, just throw any answer. Anybody know how many types, roughly? Okay, let me just go through, okay? So there's a few types of incontinence. Like as I said, incontinence can be caused by physical, cannot reaching the toilet on time, can also be caused by hormones and all these kinds. So in stress incontinence, if you leak urine during activities, for example, you're coughing or you are laughing or you're sneezing, and then you realize that, hey, I cough a bit only, I also leak urine. So this is called stress incontinence. Secondly is the urge incontinence, probably due to the infection, meaning you always want to go to the toilet. So this is a sudden, intense urge to go to the toilet, followed by involuntary loss, meaning you cannot control your urine. So sometimes you need to urinate often, including throughout the night. Okay, this is called urge incontinence. Thirdly, overflow incontinence, which happens to men. Also, you remember I told about the prostate problems. Prostate, when they press, they don't feel that they doesn't empty the bladder completely. That is called overflow incontinence, whereby you experience frequent or constant dribbling of urine as the bladder does not empty completely. And then functional incontinence, which I have explained in Parkinson's disease, whereby you couldn't reach the toilet on time due to some physical immobility, and therefore which cause you cannot control your urine and urine leaked from making to the toilet on time. Okay. So maybe some may experience more than one type of urinary incontinence. Which is called mixed incontinence, meaning you could have the stress incontinence when you are laughing. At the same time, you also could have the functional incontinence whereby you cannot make it to the toilet on time. Here, there's an example. So what can happen if you have frequent incontinence and you don't treat it or manage it? So you will have skin problems like rashes, skin infections, or even bed sores, as the skin is constantly wet. Okay, and high fall risk because the urine dribble on the floor. Okay, urine dribbling on the floor, you might miss it and then you might fall. And recurrent urinary tract infection, as you know, if the skin is always wet, there's a place for more bacteria to grow. So because of this, you can always have recurrent urinary tract infection and kidney infection. Okay, so I have explained all the.
Sorry.
Yes.
Previous slide again. Sorry.
Okay.
Okay. Thank you.
Okay, I have gone through some of the incontinence. Maybe you can take a guess. What are the emotions if a person who have incontinence might feel? Any? Just throw just any.
Embarrassed.
Yes, very good, Miss Christina. Okay, yes, of course, feel embarrassed, right? Okay. So not only it affects you on your health medical complications, but it also affects you physically, meaning, okay, because if you cannot control your urine and you always need to wake up in the middle of the night, of course you will not have enough sleep. And on top of that, you also feel very embarrassed, like Miss Christina said, which causes a limitation on your social activity. You do not want to go and see your friend. You're very pricey, right? If let's say you want to tell your friend, I want to go out, but I always need the toilet near me. Or maybe embarrassed that if you lick the urine, that you might feel that yourself are smelly, you know, that kind because of the urine smell. And this actually can have impact on your personal life and affect your social, work, and personal relationships, which also in turn can cause depression and also anxiety. See?
Can also be what they call dehydration, right? Because they're not drink water.
Correct, yes, dehydration, very good. Yes, it also can cause dehydration because you're afraid to drink water, yes. Okay, so if you have difficulty for urine control, can anybody tell me whether will you see a doctor about it or just ignore it? Okay.
Whether it will be cured, just go and have a checkup, make yourself feel better.
Okay, can. So now I'll pass to my colleague, Dr. Rosalie, to explain further.
Hello, everyone. Nice having you around. Can you all hear me well? I hope so. Yeah, if in case you can hear me well, you may share. No, we will adjust the volume. So now, Ms. Siti has already shared about the pathophysiology about urinary incontinence. We'll now move on to when to see a doctor, right? Many people think that urinary incontinence is just part of getting older, but it is not. Why? Even though our body goes through biological process of aging with time, urinary incontinence shouldn't be a condition that all of us should live with. You should always get to see a doctor early. Why? Because not only can it be prevented, if it's detected early, it can even be managed or treated. So there are many ways how urinary incontinence can be diagnosed. Your doctor would actually ask a full, complete medical history from you. Questions such as, how often do you pass urine? And what happens after you pass urine? Your medical history, like genetic family history, your occupation history, as well as if for ladies, the number of times you got pregnant and give birth. So these are all very crucial information for accurate assessment. The doctor might also perform a full physical assessment, especially to the abdominal side, to see if you have any other medical condition that is causing urinary incontinence. Because something that may be pressing on your bladder, reducing the capacity to hold urine, are also some reasons for incontinence. Sometimes your doctor might also ask you for your urine sample because they would like to ask to check whether there's any blood or any bacteria in the urine that could be causing the incontinence. Ultrasound examination, right, is a non-invasive investigation the doctor will sometimes perform on you after you pass urine to see if you have any additional residual urine in the bladder after passing urine. And these are all signs that you are having incomplete urination leading to urinary incontinence. The doctor might also recommend you to also start having your own voiding diary to record the time and the number of times that you pass urine, preferably, the amount. Perhaps not in terms of mils, but maybe, dribbles, small amount or large amount. This could allow the doctor to have an understanding the type of incontinence that you're having as well. So there are many different types of treatment for urinary incontinence, as you can see here. And we will now share on each of them. The first one will be behavioral therapy. As you can see here, we have bladder training, double voiding, lifestyle changes, and pelvic floor muscles training, which I will also go through with them now. Bladder training basically is training our bladder to pass urine in a specific time. Instead of allowing a bladder to take control of us, we will now take over the control and tell our bladder when we want to pass the urine. And to do so, we must also be realistic, right? If you know that you have the issue of incontinence, of being, feeling the urge to pass urine, perhaps you might want to try starting to train your bladder to urinate every half an hour or an hour in the very beginning. After which, you can start to lengthen the interval between your voiding times to 2 hours, 3 hours, or 4 hours, whenever you are comfortable to do so. With this kind of training, your bladder will slowly start to respond and not giving you that sudden urge to pass urine, right? And this whole training varies across people. Some people may allow this training to start taking effect with perhaps a few weeks, some perhaps a few months. It really depends on the severity of your continence level. Do not feel disheartened or feel discouraged if you take longer, because your bladder at one time will start to have this kind of habit, and don't give up on this bladder training. Another behavioral therapy that we recommend would be double voiding. Basically, it's just asking you to pass urine twice in the same voiding episode. For example, you might be sitting down, for ladies, passing urine on the toilet seat. You can actually put your both hands in front of your thighs or knees, leaning forward, and you pass urine till you empty your bladder. Instead of standing up, wait for another 20 to 30 seconds, and you start trying to pee again, right? So this is called double voiding, to make sure that you have passed out all the urine in your bladder. Another behavioral change would be lifestyle changes, as what Ms. Siti has mentioned. Depending on what is your root cause. If you are overweight, it'll be good to do some exercises to lose some weight to reduce the abdominal pressure pressing on your bladder. Also, if you are drinking, we'd like you to avoid that, reduced, because drinking is a diuretics, a type of substance that can induce you to pass urine more often than usual. And smoking also contains nicotine that will also start to increase the sensitivity of your bladder nerve to pass urine. So by decreasing smoking and alcohol can significantly improve your condition. Also, you can start having an alkaline-rich diet, food like tofu, spinach, broccoli, right? All these food are alkaline-rich diet that can also reduce your acidity level of your urine. And of course, last but not least, eat more fibers and drink more water. Eating more fibers and drinking more water always come hand in hand. Many people eat a lot of fibers, but if they don't drink water, it leads to constipation. Constipation in your intestines obviously will take up space and might press against your bladder, and that could also alter your urinary frequency. So I will now share with you the exercises. We call it Kegel exercises, where it will help to improve the pelvic floor muscles for ladies.
And let's do Kegels. Okay, this is a fun exercise. You're not going to be able to see anything, so even though I'm squeezing my hand, what I'm really doing is working my pelvic floor. Now to work this muscle, you have to pretend like you're going to the bathroom and you're stopping the flow of urination. So right now what I want you to do is now contract the pelvic floor, stop the flow of urination, and then release it. And again, contract and release. Now this time I want you to think that you're on an elevator and you're contracting, and now you're going first floor, second floor, third floor, fourth floor. Hold it there, really contracting, at the same time releasing the hip flexors and releasing the buttocks, and now lower the elevator back down again. Remember what we're doing right now. Let's go up the elevator again. First floor, second floor, third floor, fourth floor. What we're doing right now is really going to help improve your sex life as well as prevent incontinence. So it's really important to practice these throughout the day. Lower it back down again. And now let's do our flutters. You ready? Let's contract, release, contract, release, contract. Now you can be doing these anytime and nobody knows you're doing them. So you can like have a little bit of a thrill for yourself. So keep going, 4 and 3 and 2. Last one, hold it. And release. Great job. Okay, now with that in mind, let's take it, continue Kegling, and let's take it up into a bridge. So what I want you to do is peel your back off the floor, starting with your tailbone, elongating your spine, coming all the way up, keeping your belly in and your rib cage knitted closed. And what I want you to do is think, neck and chest, everything is relaxed and long. Bring those knees together, and now drop and pump. Drop and lift. And drop and squeeze the buttocks, and squeeze, and squeeze. Give me 4 more, and 3. If you want a little bit more intensity, let's bring that right leg off the floor and continue to drop and squeeze. Try to squeeze your knees together to get a little inner thigh work going. And up, down, up, down, up, down. 1 more, let's switch sides. Bring it up, down. If this is too intense, just keep both legs on the floor and keep the motion going. It's up, down, 4 and 3 and 2, and last one, hold it and drop it down.
Right. Although, right, you can see that the exercise is done with the person lying flat on the floor, but once you master the correct way of contracting your pelvic muscles, you can always do it even when you're watching TV or sitting in the bus, waiting for anyone. So this exercise can be done discreetly without anyone knowing, yet it can help to strengthen your pelvic floor muscles. And of course, we are done to the ladies. We now move on to the gentlemen on how we can perform Kegel exercise for gentlemen as well.
And let's do Kegels.
Now we move on to the male.
Hello everyone, my name is Swan Hui. I'm a pelvic health physiotherapist from SGH. Many men with prostate diseases have an issue with urinary control. In this video, I'll be talking about how to do your pelvic floor muscle exercises correctly to help to control urinary leakage. Let's take a look at where the pelvic floor muscles are and how to move them with this animation created by the Incontinence Foundation of Australia.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder and bowel and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around the base of the penis as if you are trying to stop the flow of urine. You should see your penis draw in and your scrotum lift up. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice, as the pelvic floor muscle tightens, the anal passage closes. The same action happens to the urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Let's try moving the pelvic floor together. Choose a position where you can feel the movement the best. That could be lying on your side, sitting, or standing. Take this opportunity to get into the position of your choice. There are two main components to the male pelvic floor, the front and the back. We'll start with the front. To contract the pelvic floor muscles, pull the penis back into the body and then relax completely. What you should feel is as you contract the pelvic floor, the penis lifts slightly, and when you relax, it returns back to the original position. Take this opportunity to perform that a few times. Can you feel it? It's a small lift of the penis and the scrotum. The tummy muscles should stay relaxed, and you should be able to continue speaking if you need to. Now, let's include the rear part of the pelvic floor into the exercise by tightening around your anus like you're trying not to pass wind. Can you feel the movement well? Your buttocks should remain relaxed, so if you are seated, you shouldn't be moving up and down in your seat. If you can't feel the movement well as you are trying, try another position. Lying down on your side might be the easiest one. Getting the right technique can take up to 2 weeks, so please be patient when you're trying. If you're using the wrong technique, then the exercise will not result in any improvement. In fact, using wrong technique can result in worsening of the leakage. So it's important that you check that you are doing the pelvic floor muscle exercises correctly. You can check by performing the exercises in front of a mirror. You should see that the penis and scrotum lift as you contract the pelvic floor and descend as you relax completely. Once you get the right technique, try contracting your pelvic floor several times throughout the day. For example, when you're waiting for the lift, when you're waiting for transport, or when you're queuing up for something. Start with a number of contractions that you can do with good technique for better results. Once you are able to do 10 pelvic floor muscle contractions comfortably with good technique, you can progress to a slightly more difficult exercise where you hold the pelvic floor muscle contraction. For example, if you're able to hold the pelvic floor muscle contraction for 3 seconds and repeat that for 5 times with good technique, you will practice that frequently throughout the day. Gradually increase the holding time to 10 seconds and increase the number of repetitions per set to 10. It might take you 3 months or more to get there. Take your time to increase the difficulty of the exercise with good technique. Remember to tighten your pelvic floor before you engage in activities that can cause leaks, such as before you get up into standing from a seated position and before you cough and sneeze.
All right. So that is about the exercise used to strengthen the pelvic floor for both gentlemen and ladies. However, bladder control problems can still persist even after making conscientious efforts on the lifestyle changes and even after bladder training. When such situation happens, you are always encouraged, strongly advised to seek advice from your doctor, such that medical drug therapy needs to be involved. So the drug therapy prescribed to you usually allow you to reduce the urge incontinence because the drugs will help to reduce the sensitivity of overreactive bladder. So please speak to your healthcare professional like doctors when the above still doesn't work well. Having said that, drug alone doesn't solve urinary incontinence. You still need to continue to work in tandem with your behavioral therapy and bladder training as well. For most severe conditions, the doctor may start to advise you to go for surgery, generally for ladies with pelvic floor issues. And the surgical techniques ranges from people to people according to the root cause of your urinary incontinence condition. So, but in general, what the surgery ultimately aims to do is to help to increase the pelvic floor muscles strength and to help hold your bladder better so that you will be able to control your symptoms. For ladies who are unable to go through the surgery physically because of some medical condition, another option will be the vaginal ring pessary. This is actually a flexible silicone ring that is being inserted into the vagina to help support the internal organs so that the ladies are able to control their bladder better. So in summary, this is just some tips for keeping a healthier bladder, right? On this poster, right, we will focus on what we can, the drinks that we can take and what we should avoid. Now, in general, as what Ms. Siti has mentioned in the very beginning, we will always want to reduce drinks that have diuretics kind of components, right, such as Coke or maybe alcohol and tea and coffee. However, if you love tea and coffee, you may ask for decaffeinated coffee or tea, or sometimes you really love drinking tea and coffee, you would like to start limiting the amount, right? Not to get it too concentrated, so that you're able to have a better controlled bladder training while still not compromising a lot of your quality of life. So that's all from us, and we welcome you to join us for our next health talk. And we will now move the time, right, to more question and answers. Any questions? Any questions that you want to clarify?
If you do not have any questions, you want to talk to us, you can also give us a call. This is our main hotline from Monday to Friday, 8 to 5 p.m. And then the commoners we will answer questions accordingly. And we also can give you the list of community nurse posts. Probably if you're residing in Radin Mas, we also have a nurse post in Radin Mas CC as well, or anywhere around the Southeast region now. Okay. Any questions for our health talk?
We hope the talk has been beneficial to you. And also, even if you're not having urinary incontinence, it is actually advisable to also perform Kegel exercises during your own free time to maintain a healthy pelvic floor muscles. Yeah.
Will this be repeated next Monday in Mandarin? Will this talk be repeated in Mandarin next week? Hello?
Okay, let me answer that. Yes, actually next Monday it will actually be our Mandarin version of this talk. So it will be 鸟诗经. So for those who actually join us today and expecting a Mandarin version, then you can actually join us next Monday for the Chinese one.
Thanks.
Thank you, Felicia.
No problem. So if you all don't have any questions for our nurses today, don't worry. But if you think, I think I got a question, I need to ask the nurse. Don't worry, next week, same topic in Mandarin. So you can actually keep your answers and then you can check in with them next week again during the talk. So meanwhile, while we hold on for a minute, I think we can let Radima's team to actually let you all scan your passion card points. Yeah. Yeah, so for those who want to earn your passion points, now you can actually take out your handphone and then scan the QR code. For NTUC Health at Bukit Merah or Depot Heights audience, you all also can take out your phone. Yeah, I see the NTUC side or taking out their handphone to scan the passion card points to top up your points and so. Okay. If you have done scanning the passion points, then I think Siti and Dr. Roslyn, we will end today.